Dr. Jaffe, we have a customer writing in asking, how does lymphocyte activation indicate all three types of hypersensitivity in the LRA responses?
Well, the uniqueness of the LRA, the uniqueness of the lymphocyte response assay that we have been offering clinically since 1983, that we pioneered, brings together amplification technology using the cell surface for the first time as the amplifier, along with high purity substances, antigens, that are presented in the ex vivo natural way by APC, antigen presenting cells. And when the white blood cell, whether it be T cell, B cell, or immune complex activated, when the white blood cell that has previously been programmed to see this as a foreign invader has the key provided by the antigen presenting cell put into the lock known as the MHC locus of the cell, a whole series of things take place. Over 3 weeks, a colony of cells, over 3 or 4 days, thymidine, radioactive thymidine would be incorporated into cells as they begin to divide. What we do is look even earlier at the original kinase activation. That's what we pioneered and continue to provide, so that whether it be B cells, immune complexes, or T cells, we cover it. And yes, you might like to know, and we might like to know, is it actually T cell or B cell in a specific individual item and case? And the answer there is the cost. It can be done. We can do it. We have done it for research purposes, but the cost to consumers and to clinicians would be very high. And you'd need lots more specimens. Lots. We have the most efficient system for looking directly ex vivo at lymphocytes as they activate, and then we provide the clinical tools to restore tolerance and to induce healing responses and repair. We'll get better over time. We have many case successes to share with you. We have many pieces of evidence that others have done to show how accurate, how precise, how reproducible we are. So please continue to ask and to know that this is the most functional ex vivo way to know what people can eat or get exposed to safely, more safely, and what they need to avoid, and where there might be hidden places that they might be getting exposed to the very things that are burdening their immune defense and repair system. So while we restore hormonal and neurochemical tolerance, while we improve digestion and detoxification, while we improve metabolism, we also want to make sure that the fundamentals are taken care of and that the clinically important and useful information is provided to our colleagues and to their clients in a very cost-efficient, high-value way. Yes, there's always new studies to be done, and yes, there's always more precise techniques of which we are aware, but it takes a lot more specimen and it would cost a lot more money, and I'm not sure clinically that it would add that much value. So trust us, it's both T and B cell reactions as well as immune complex activated lymphocytes, types 2, 3, and 4 in the old gel and Coombs nomenclature. I'm old enough to have known when they published that in the 1960s when I was still a student. And Coombs, of course, was famous for the Coombs test. Gel happened to be atopic or allergic, and they worked out this type 1, 2, 3, 4. Type 1 is histaminic and different. And then you have the overlap of types 2, 3, and 4 clinically in the form of Arthus reactions, serum sickness reactions, Schwarzman reactions, and many other reactions where the delay between exposure and symptom is so long, sometimes days or weeks, that even the most careful history, even the most careful rotation diet will not solve the problem and may actually, in some cases, create some deficits in essential nutrients. So please let us help you get the good stuff in and the bad stuff out, and do it in high value, clinically useful ways.